Estamos ok, gracias. Para que te salgáis nomás, gracias. Ya, chiquillos, vamos a empezar a aceptar a los invitados. Vamos a tener el cartón, así que para que por favor no ponen los micrófonos ni nada. Muchas gracias.
Ahora cuente. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3. Solo sé contar hasta 10, me repito.
Muy buenos días, estamos ya a minutos de comenzar con esta actividad. Les solicitamos identificarse para poder ya tener claro quién representa a qué país y también tener un orden en esta ceremonia virtual. Le solicitamos a quienes están conectados vía Zoom identificar el Zoom, el
Those
nombre,
who
ya que
join
algunos
us over Zoom
aparece
today,
solamente
please,
como iPhone. Le
there
solicitamos,
is
por
one
favor, colocar su
person
nombre
that
para poder
has
tener
not put their
claridad
name in yet, which
en lo
just
que es
says
esta
iPhone.
conexión.
It
Muchas
would be very
gracias.
nice for us to know who joins us today.
Muy buenos días. Invitamos a las personas que van a participar
morning.
activamente de esta
We would like
actividad,
to invite everybody
encender
who will
sus cámaras y
participate
cerciorarse de
actively
que
to turn on
éstas
your
tengan
cameras
el nombre correcto.
Take
Por
care
favor,
that your name is
corroborar
also
que sus
displayed
cámaras, su
below your
conexión
image.
tenga el nombre correcto y la cámara esté encendida.
Please turn on your cameras and put in your name in your Zoom account.
El nombre correcto es la inicial de su país y a continuación su nombre.
The correct name is the abbreviation of your country and your name. Thank you.
Muy buenos días.
Good morning.
Para hacer óptima esta conexión,
To
los invitamos a
make
revisar
the
la
best
parte
event,
inferior del Zoom,
we would like to
donde
advise you
se
that
encuentra un
you
icono que dice
can
interpretación.
use interpretation for this event below, which is
Ahí podrán
a
seleccionar
world
el
icon,
idioma
and then
del
you can
cual quieren
select
escuchar
the,
esta
the
conexión.
language you want to
Muchas
listen to.
gracias.
Thank you very much.
Les comentamos que los idiomas disponibles es
The
inglés
languages
y
available
español.
are English and Spanish.
Ministros, muy bienvenidos.
Honorable
Comienza de la
ministers,
siguiente forma.
welcome.
Hay una locución que da la introducción al evento.
We will
Después hay una
start with
fotografía
an
oficial, en la que hay que
introduction,
mirarse
then we
frente a
have
la
the
cámara.
official
Después hacemos una
photo,
segunda fotografía saludando,
and then
y
a second photo
la
where you
locutora le da
greet
las
to the
palabras al
camera,
presidente para que haga su intervención.
and then the
Acto
president
seguido,
will start with his
se presenta
introduction.
un video que dura 5 minutos.
Then we
y es
will
en ese
show a
momento en el que
video
hacemos
of
el
5
enroque entre el
minutes,
presidente Sebastián Piñera y la Paula Daza.
And some words from Doctora Paula Daza and the President Piñera.
Buenos días a todos los presentes,
Good
autoridades y
morning,
asistentes.
authorities
Me
and
complace introducirlo que
participants.
será el evento
It
de
is an
alto
honor
nivel,
to introduce you
Encuentro de
to
Líderes
today's event,
Latinoamericanos de Salud,
High Level Exchange of
cuyo
Latin American
objetivo es
Health
continuar con la
Leaders
colaboración internacional,
and
el intercambio de
international
experiencias
collaboration,
y
and we will
estar preparados
exchange
para la evolución
lessons
de la
and
pandemia.
experience
El
during the
encuentro está
pandemic.
siendo transmitido por la
This
plataforma de
exchange
YouTube y por el
is
canal
transmitted
oficial
over
del
YouTube
gobierno
and
en la
the official
plataforma
government channels,
www.gov.cl,
www.gov.cl, and will also be recorded through the same
La reunión
channels.
cuenta con traducción al inglés, a la cual pueden acceder a
Translation
través
and
del botón
interpreting is
indicado para
available
este idioma en
for
la página
English and Spanish.
www.gov.cl.
Can
En
access
primer
this
lugar,
English
les
version through the
pedimos 5
same
minutos de
website.
colaboración, ya que tomaremos
We
la
would like
foto
to
oficial del
invite
evento,
you
tanto de
to
los
take the
exponentes que
official
se encuentran
photograph
presencialmente
for
como
the
de las
speakers that are
autoridades
present
presentes
in person
virtualmente,
and also
para quienes
those who
solicitamos
join us
mantengan sus
virtually
cámaras
today.
encendidas.
So we would like to ask you to turn on your cameras, please, for this photograph.
Los invitamos a mirar hacia el frente.
We would like to invite you to
En
look
3,
straight into the camera
2,
in 3,
1.
2, 1.
Ahora los invitamos a seguir mirando hacia el frente
Please
y
keep
saludando
looking
hacia
into
la
the
cámara.
camera and greet, wave, say hello.
Perfecto, muchas gracias.
Thank you very
Estamos
much.
listos con la fotografía oficial.
The photo has been
Y
taken,
para introducir este evento
and
comenzaremos
I would like
con
to
unas palabras
introduce you
de Su Excelencia
to
el
this
Presidente de la
event
República de
and
Chile, don
His
Sebastián
Excellency
Piñera Echenique.
President Sebastián Piñera.
Muy buenos días. Bienvenidos a este encuentro
Good
de
morning.
líderes
Welcome to
latinoamericanos de la
this
salud.
event,
Todos
high-level
hemos
exchange
vivido
of Latin American
y hemos
health
sufrido
leaders. We have
los
all lived and suffered
consecuencias de
the
una pandemia
consequences
sanitaria,
of
la
the
peor
health
pandemia sanitaria de
pandemic,
los últimos
the
años.
worst health
Y hemos tenido que
pandemic from the last 100
Porque una
years.
cosa es
And we
denunciar y
have
exigir, pero los
faced
gobiernos
that
tienen que enfrentar
because
y
governments, we have to face
Yo quería
and
contar una pequeña
resolve
experiencia
the
personal,
issues. I want
porque
to
a mí me ha
share
tocado
with you
gobernar en
a
tiempos
personal
muy difíciles,
experience
en ambas
because
ocasiones en que
Both times I have been the president, the first period, we had an earthquake that almost destroyed a third of our infrastructure and cost hundreds and thousands of lives. And now, these hard times, there is from one part the pandemic of COVID and the recession worldwide and the continent in peace of Europe that we believed, but that now is not. So the lessons that we've learned, we have to take it seriously from the first instance and be prepared, because countries, we were not prepared for the coronavirus pandemic. None of the countries. So the alerts, the lessons we learned, we need to take it seriously. And in the case of Chile, we knew the news in 2019, and the first days of 2020, we started integrating the public and private health sector before the pandemic appeared here in Chile. So that allowed us to have a protected health system. Also, you have to make advances before the things happen. How are going to be the next steps to face the health issues? And the vaccines were the way we found to face it, and we started negotiating them in May, and we established a very timely vaccination program. Also, the country has to be united in the challenges. We don't have to fight, we need to be together. Find collaboration between the private and public health sector. We need to collaborate, be friends with the private and the public health sector to face the pandemic. And finally, it is very important that our citizenships, our fellow Chileans, are very, very well informed with good information, that they know that they are part of the problem, but also part of the solution. Transparency in communicating the citizens about the things that they are going through. Most of the countries, these humble pieces of advice that I'm giving you as president, I'm going to tell you this is not going to be the last crisis, the last pandemic. With the international collaboration in our continent, we appreciate the work that we have done with Prosur, the WHO, and others, and sharing experiences, and look for collaboration, collaborating with each other in anything that can be too much in our country and be lacking in another. And together, facing this crisis is not, you need to think that it's not a problem for each country by itself, but it's something that we need to face together, because we are going to be safer that way. So I appreciate you for being in this exchange of Latin American health leaders. I greet the health ministers, also Dr. Paris, also Dr. Paula Daza. They were from the beginning pushing this encounter, this exchange, and the aim is that the countries work together and face the challenges to protect in a better way the health of all our fellow citizens.
Thank you very much for this emotional message. And now we will move on to Dr. Carissa Etienne, PAO Director.
Your Excellency, President Piñera,
Excelencias, Presidente Piñera,
Honorable Ministers,
honorables
distinguished
ministros,
guests, Ladies and gentlemen,
Señoras y señores,
thank you for inviting me to
muchas
this
gracias
important
por la
exchange
invitación
of
a
lessons
este
from the COVID-19 pandemic.
intercambio de aprendizajes
Over the
de
past 2
la
years,
pandemia del COVID-19.
Latin
Durante
American
los
nations
últimos 2
have
años,
experienced
las naciones de
historic
Latinoamérica
shocks to the
han
healthcare
vivido
system,
choques
their
históricos
economies and
a sus
societies.
sistemas de salud,
The
economías y
human cost
sociedades.
of the pandemic has been
La pérdida
extraordinary.
humana ha sido extraordinaria. 147 millones de casos, 2,6 millones de vidas perdidas y muchas familias que han perdido uno de los suyos. Aún así, la respuesta de la región también ha sido extraordinaria. Gracias al liderazgo de muchos que están aquí hoy, la valentía de nuestros trabajadores sanitarios y la resiliencia de nuestra comunidad. La OPS trabaja con sus Estados miembros en un plan para transicionar desde una respuesta aguda a la pandemia hacia uno de control sostenido. Mientras miramos el futuro, será esencial usar a nuestro favor lo que hemos aprendido durante la pandemia para optimizar nuestras estrategias. Y aunque estamos hablando de transición, es importante reconocer que la pandemia no se ha acabado en Latinoamérica. Mientras los casos ven una bajada sostenida, todavía hay tasas de mortalidad muy altas, que son las más altas desde la pandemia. Y por eso nuestras prioridades son, primero, proteger individuos, sobre todo los más vulnerables, de la exposición al virus. Segundo, reducir el riesgo de variantes. Y tercero, bajar la tasa de enfermedad y muerte. Las vacunas son nuestra herramienta más poderosa para alcanzar estas prioridades. Son un logro científico nunca antes visto y han hecho el impacto más grande en reducir la mortalidad en grupos de alto riesgo. Aunque más de 668 millones de personas han sido vacunadas con el esquema completo en las Américas, todavía hay equidades importantes en el acceso a las vacunas. Y es esencial aumentar la cobertura de vacunas contra el COVID-19, incluyendo refuerzos para salvar vidas. Si miramos al futuro, hay 3 aprendizajes que deberían formar nuestro enfoque de salud pública mientras reformamos nuestra región. Primero, COVID-19 expuso debilidades de nuestro sistema de salud. Y esto afectó nuestra respuesta y nuestra habilidad para mantener los servicios de salud esenciales. Y aún ahora, después de 2 años, hay Estados miembros que reportan disrupciones a la mitad de estos servicios de salud esenciales. Construir sistemas de salud más resilientes es esencial para superar esta crisis y para prepararnos para futuras pandemias. Y por eso la OPS recomienda que el 6% del PIB se invierta en salud pública y el 30% de este gasto al primer nivel de cuidado. La salud del primer nivel es la plataforma más efectiva para entregar calidad y cuidado integral a todos. El segundo aprendizaje es que Latinoamérica depende casi 100% en otras regiones para materias primas farmacéuticas, medicinas y otras tecnologías de salud. Y así la región queda vulnerable a disrupciones de cadenas de suministro y limita el acceso a innovaciones de salud que salvan vidas. Por eso es muy importante que los países colaboren para fomentar la producción regional de productos medicinales. Y así vamos a mejorar el acceso a tecnologías de salud, contribuir a la seguridad nacional y regional y fomentar el desarrollo económico. Por fin, el tercer aprendizaje es que el motor más grande de enfermedad y muerte de COVID-19 ha sido la iniquidad. Antes de la pandemia, casi el 30% de personas en las Américas no tuvieron acceso a servicios de salud por quienes eran, donde vivían o porque el costo era demasiado alto. Y a pesar de que 65% de las personas en Latinoamérica y el Caribe han recibido un esquema completo de vacunación, solo la mitad de los países de bajo y medio ingreso recibieron una vacuna de dosis única. Tenemos que eliminar estas inequidades para realmente construir una región más saludable, más resiliente y más próspera. La cobertura universal de salud debería ser su prioridad en sus agendas políticas. La solidaridad y la cooperación han sido nuestros grandes esfuerzos por más de un siglo. Y sabiendo que todos ustedes trabajan juntos, me da esperanza y confío que el 2022 será el inicio del fin de la pandemia. Muchas gracias y les deseo lo mejor.
Muchas gracias a la doctora
Thank
Etienne
you
por sus
very
palabras
much,
en este
Dr.
encuentro de
Etienne,
alto
for
nivel
your
líderes
words
latinoamericanos de
in
salud.
this
A continuación daremos paso a unas
encounter.
breves palabras
Next,
del
we
ministro
are
de Salud de
going
Chile, el doctor
to have
Enrique
some
París.
words from Dr. Enrique París, the Minister of Health of Chile.
Tenemos aquí,
Good morning.
ministras y ministros
We have here
presentes, y a nuestra querida
the
Paula
ministers
Daza, asesora
and
presidencial
also
en
Dr.
materia de
Paula
salud de
Daza,
internacionales de salud, y que
our
ha sido
advisor
realmente
in
la
health
organizadora de esta reunión. Quiero saludar a
issues
Jimena,
and also the
a la
organizer
doctora
of this
Garzón
meeting.
Mellado,
I
ministra de
want
Salud de
to
Ecuador, al doctor
greet
Daniel Salinas,
the
ministro de Salud de
Minister
Uruguay,
of Health of
y a nuestro
Ecuador,
amigo
Uruguay,
Fernando Ruiz Gómez, ministro de
and
Salud de
the
Colombia.
Minister of Health
Quiero
of
saludar y
Colombia.
agradecer la presencia de todos los
I want to
asistentes a esta
thank
importante
the
jornada de salud
assistants of
hoy
this event,
en
the
Santiago de
attendees
Chile.
here in Santiago
Saludar
de
al presidente de
Chile.
Chile,
Greet
señor
the
Sebastián
President,
Piñera,
Mr.
a la
Sebastián
señora
Piñera,
Carissa Etienne, la doctora Carissa
Dr.
Etienne,
Carissa
directora de la
Etienne,
OPS,
also Director
a
of
las
the
ministras y ministros de la salud de la región
PAHO,
que nos acompañan, que ya los nombré,
the Minister of
y
the
también a todos
region,
aquellos
again,
que están
and
conectados
also all the
telemáticamente,
attendees that
y
are
a quienes les
attending the
agradecemos
event
obviamente su presencia,
via
y a todos los asistentes a esta
virtually,
reunión.
and
Es
also
un
all
gran
the
honor para
attendees
mí
of the
representar en
meeting.
nombre del Ministerio de Salud de Chile
It is
la
an
apertura de
honor
esta
for me
jornada,
to
la cual
represent
tiene
the
como objetivo
government
resumir
in
y
this
compartir los
moment
aprendizajes y
to
logros de
share
la
the
región
learnings of the region
respecto
with
de lo
you
que ha sido la más
with
importante
regards
crisis
to
sanitaria en los
the
últimos 100 años. No
this
solamente
health
para la región,
crisis,
sino que
the
para todo el
most
mundo.
big,
Hoy
the
por hoy, a
bigger
nivel
one
global,
in
los
the last
países
100
implementan y
years,
ejecutan sus
and how
estrategias
the countries
para dar
implement
respuesta a la
and
gran cantidad de
execute
contagios
their
que ha provocado Omicron,
strategies,
la variante de COVID-19
and
más
how they are
contagiosa
facing
que hemos
Omicron, the
conocido en estos 2
most
años.
virulent
Pero a diferencia de
variant
lo
of
ocurrido
the
en el inicio de esta
COVID-19,
pandemia,
and also
hoy
what
contamos con
happened
recursos
at the
que el
beginning of the
tiempo y el
pandemic, that
trabajo
we didn't have
nos han ido entregando.
resources, but now we have it.
Conocimiento
Also, we have
y
experience now,
certezas que permiten a
knowledge
los
and
equipos de salud
certainties
brindar
that
atenciones más
allow the health
eficaces
teams to
y
give
salvar vidas.
more efficient
A 2 años de
solutions and
iniciada la
saving
pandemia, la
lives.
ciencia, tecnología y
2
la
years
colaboración
has passed since the
público-privada que en
beginning
nuestro
of
país
the
hemos destacado
pandemic,
muchísimo,
and here in
nos han
Chile,
permitido
the
contar con
private
valiosas herramientas
and public
como las
sector
vacunas, con una
linked
importante
has
cantidad de
allowed us
laboratorios que hoy son
to
capaces
have
de producirlas,
vaccines from
con
several
una tecnología de
laboratories
testeo
with a
impresionantemente desarrollada.
impressively
Todos estos
developed
elementos han
technology
continuado
for testing
evolucionando y han
that
permitido
keeps
la estrategia de
evolving
trazabilidad
and
y
allowing the
aislamiento efectivas y
T-
sostenibles en el tiempo,
tracing,
y los
testing
cambios y evolución en cómo las
strategy
medidas más
and
duras,
seeing the
las
changes,
que implican mayores restricciones de movilidad,
having
han podido
strict
ir
measures
evolucionando
restricting the
gracias a la
mobility
mejor
of the
comprensión del
population,
virus y
and
su
also
comportamiento.
the understanding that
Y
we
vuelvo a
have
insistir en algo que no
acquired
debemos
from
olvidar
this
ni poner
virus.
jamás en segundo
We
plano.
don't have to
Seguimos
forget
en
and put in
pandemia,
the second
quizás en una etapa
stage that
diferente,
we are
pero
still
una
in a
mirada en
pandemic.
retrospectiva nos permite reflexionar
but also
y a
we
la
can
vez
reflect
reaccionar
and react
sobre el devastador
on the
impacto
fact
sobre la salud
that
mental
and
de
the
las personas,
impact in the
el grave efecto
mental health
sobre el
of
acceso a
the
tratamientos de
people,
enfermedades crónicas que han quedado
the
postergadas,
access to
y
chronic
también,
illness
obviamente, reconocer la
treatment,
capacidad
and
de
also
resiliencia de nuestro
recognize the
sistema de salud
resilience
a futuras crisis sanitarias.
ability of our health
Yo, a
system
nombre de todos los
for the
ministros, quiero
upcoming
agradecer el trabajo
crisis in
de
health.
miles
I
de
want to
millones
thank
de funcionarios de
the
la salud,
work of the
tanto de los
health
hospitales
teams in
como de la atención
hospitals
primaria, que nos han
and
ayudado a sobrellevar
primary
esta
health
pandemia.
assistance
Nosotros estamos orgullosos
through
y
the
agradecidos
pandemic.
de
We are
todos los
very
funcionarios.
proud and
Al
thankful
mismo
for
tiempo,
their
no podemos
work.
soslayar que estos efectos han sido desiguales,
These effects have been
afectando
unequal,
inequitativamente, y
impacting
esto quiero reforzarlo,
unequally. I want to be very clear, unequally affecting and impacting the poorest sector of our country and Latin America, and also worldwide. There is a reflection there that the President Piñera did. We have to work in solidarity jointly to help the world to surpass this pandemic and be prepared for the next problem. This COVID-19 pandemic has been conceived as a threat for the world, but in Latin America, there is the fifth part of the confirmed cases of COVID-19 and around the 30% of the deaths around the world. A report from PAHO and CEPAL, the time that this pandemic has endured, has impacted the economy, and SARS-CoV-2 has helped us to fix the problems in the health system around the world. And I'm sure that our colleagues, the ministers of health in Latin America, are putting their heart, their mind, their work to try to fix the health issues in our population. And through that, covering the demands of health services, calling the countries to work together and be prepared in case of a pandemic. There is a request from the countries members of the WHO in a recent assembly of health. Some of us were there. The issue that was said is that we need to work together to face the next pandemic. We need to achieve that in the future. They say that the leaders of this time had the bravery to work. It is our hope that in this encounter with leaders and authorities of health, that the mission, the vision, and the collaboration of the people in here is renewed and persistent through history. Also, as we work together for the freedom of America, to serve as an example for the next generation that is facing the pandemic present nowadays. These are the sincere desires of that we are allowed to be closer as brothers and sisters, as countries in the same objective. Thank you.
Thank you very much, Minister, for your words. And we will now have a panel of 4 countries that will share their national experience concerning the pandemic. The first speaker will be Dr. Fernando Ruiz Gómez, Minister of Health and Social Protection in Colombia, who will talk about equity and risk communication in the context of the pandemic in Colombia. Good morning. A special greeting to Minister Paris and all Chilean ministers and colleagues. Thank you very much for this invitation. This is very important for all of us. I would like to start my presentation now with some slides, because today, 2 years ago, I was named Minister of Health. And then, 2 days after this, we had the first COVID case in our country. So this whole process was initiated where Colombia, as all the other countries, had to face this crisis in our country. Which means that in the Bloomberg ranking, Colombia is on the 8th place among 53 economies that are considered to have good resilience to the COVID-19 pandemic, and this has allowed progressive and continuous coming back to our normality, which means that Colombia, for 2 years, and 2 years ago, took the decision that we could not have a difference between good and bad reaction to the pandemic, and also opening of the economy and development, which means we need an economy that works also for the poor. Next slide. Colombia is a very special country because we have about 51 million inhabitants, 76% is urban and 23% is rural population. And one of the biggest problems is poverty, which is about 42.5%. And the Gini coefficient lies at 0.513. And we have a very complex migration issue, mostly from Venezuela, of 1,700,000 and more. And 759,000 are regular immigrants, and 983,000 are irregular immigrants. And we have more than 4 million migrants that have entered the country and are still in some kind of limbo. And Colombia has made an effort to publish policies to tackle this migration issue. And we still have conflicts of drug trafficking in many municipalities. And concerning our health system, that has been consolidated over the last years, that we have a coverage of almost 100%, 99%, which means that almost all Colombians have health coverage, of which 47% is subsidized population. We have 11,000 health providers, more than 11,000. 1,000 are public and 10,000 are private providers. And probably with Uruguay, we have one of the lowest percentages of out-of-pocket expenses of just 15%, which is very low. And then 8.5% of health spending in proportion to the GDP. We rose from 6 to 8%. We have centered on strategy which has three main priorities and orientation routes. First, which is just universal well-being. Colombia has a history of individual rights concerning the health system, which means that we have collective rights, and it was very complex to cope with this pandemic. The second principle is subsidizing because we have a lot of population in conditions of poverty. And then we need development for all health interventions. As I already said, we have social determinants and family determinants and also economic determinants that are like the three fundaments of and basis of the intervention by the state. And we have to take these into account. On my next slide, this has been our execution. We have well-being. There are three main elements, which is governance, the sanitary emergency has to be priority number one in the health sector. And then also concerning the legislative structure of the state, Colombia in the last 2 years has tried to solve this sanitary emergency from a legislative point of view. Then we have the prevalence of the health sector. We had a political intervention plan. We created protocols that also the economy had to accept, because Colombia had a special crisis with this intervention, because there was just one lockdown, which we declared during the first months of the pandemic, from March to May. But after this lockdown, we have not declared another lockdown, and this has been essential. We just took other measures such as social distancing, which we have maintained, and have a very organized society and maintained our protocols. The third element is to take decisions in consensus, which means that health policy decisions are always comprehensive with academia, with doctors and doctor associations, and also hospitals and their associations. We also controlled resources, which means that we took the decision that our system needs to subsidize every Colombian that lost their job because of the pandemic. Those were about 2 million people, families that we supported financially so they could maintain their stability. They were paid, there was an amount paid during the lockdown so they could maintain their families. And some other measures we have taken concerning human resources. Of course, health staff. We paid bonuses to health staff. We prioritized them among the vaccination process. And we also have our national vaccination plan, where we prioritized, of course, the most vulnerable groups and moved on until the youngest population. Right now, we are vaccinating children from 3 years of age. And we vaccinated the second dose after 84 days. Because in recent studies, it was shown that this creates a longer immunity and longer coverage using the second dose in a longer time. And then also we've concentrated on the territorial management. We increased our ICU beds to 13,000, and the whole health system was integrated in a public and private system, which meant that we safeguarded access for all Colombians. So all Colombians had access to an ICU bed independent of their situation. When we talk about inequalities, I told you about the Gini coefficient. The Gini coefficient was considered for the vaccination and remained at 9.5%, which means 9.6, which means that it was a massive effort to distribute vaccination in equality and that every Colombian could receive a vaccine. Another very important data. We try to foster knowledge, and Colombia has also conducted studies and cohort studies with more than 30,000 people involved. We have the Esperanza cohort, where we investigate the effectiveness of the vaccine and also deaths that could be avoided by vaccination. And it shows how just in the year 2021, in the age groups 60 to 69 years, we could save 22,000 lives because of the vaccine. So these are very important results. And then effectively, vaccination was one of the most important tools. And when we look at our Esperanza cohort, we could say that we saved more than 50,000 lives in Colombia because of vaccination. On my next slide, I would like to finish up with this graph that shows the perception of people of the management by the presidency of the COVID-19 pandemic. From the beginning of the pandemic until 2021, and we can see the acceptance rate of the Colombian population, which reached until 72%, which means that more than 70% of Colombians approve of the president's action to cope with this crisis. And this is a very important result, because this shows that Colombians trust the policies we publish, and also that they trust the health minister. And we can see some decrease that was June and July last year, where we experienced a very complex social situation. It's still complex, and still 60% of Colombians consider that our response to the pandemic was positive, which means that this was one of the most positively received public policies. And on the last slide, I would like to thank you for this opportunity. And of course, it's very difficult to talk about one country and not put it into context. And we published, this article was published this month about the perspective of Latin America and the Caribbean concerning the COVID-19, the fight against COVID-19. And it shows the perspective of our region, Latin America and the Caribbean. And all of us and some ministers that are joined here today have contributed to this article, and especially the whole continent has contributed, and we need efficient protection. This should not be an isolated effort, but we as countries and societies and governments have to collaborate with all the countries in the Caribbean, Central America, and our South American countries to safeguard what Minister Paris already mentioned, that we cope with these problems of adaptation and going back to our normality and cope with this situation as countries together. And we need to make a real effort to make progress together. Thank you very much.
Muchas gracias, doctor.
Thank you very much, Doctor, for your words. Now we have the words from Dra. Paula Daza, Presidential Advisor of the Health Minister. She's going to show us the experience, the Chilean experience in vaccination and integration of the public and private sector health in the context of the pandemic. Welcome all the authorities. I greet you and also the attendees. Now we have passed 2 years of the pandemic, and we want to share with you our work system, our achievements. It has been very difficult, and we need to keep working to face the next pandemics. I want to start the presentation with the lessons that we've learned from these 2 years. First, I want to show you the achievements of our country in these 2 years. The first one is important to show you that thanks to the integration of the public and private sector, we can say that there was no lack of critical beds in our country for any patient. Also, thanks to the vaccination process that we implemented very early in the pandemic, that we've been able to vaccinate and move more freely, but also we have these lockdowns, but we, thanks to the vaccines, are more free now. And how we've achieved these goals with the work of many, many people, not only from the health sector, but also with many other stakeholders. I want to refer to the 2 topics I'm going to talk about. First, the cooperation between the public and private sector, and secondly, the vaccination. How this collaboration between the private and public sector worked. The first case of COVID in Chile in March of 2020, the Ministry of Health took control of every critical bed in the country, private and public sector. And thus, we were able to coordinate the beds. Next slide, please. Also, I want to show you how we achieved that coordination, and for that I need to tell you how the health system works in Chile. We have public insurers, FONASA we call it, and also we have private health providers, and also the military health provider. We have mainly health public providers, and with respect to the private providers, the people from FONASA, the public sector, they can go to the private sector and also the public sector for ambulatory assistance and in hospitals. And this collaboration that we've been working for many years ago is what it prepares us for the for this pandemic. So when we had the first case of COVID on March 3rd of 2020, we took control of every hospital in the country. We issued a decree for the Minister of Health had the ability to derivate patients from any region, any place, to any place there were a critical bed available, and to provide health care for these patients. Also, we created the centralized clinical management unit that controls the demand of critical beds. We've been using this system for many years now because we were allowed to transfer patients from one hospital to another hospital in different regions, and public and private hospitals. During the pandemic, this unit and this clinical management was strengthened with more technology, with more resources, with more human resources, composed by health professionals, technological professionals, and engineers that is working day after day, 24/7, with the demands of beds. Where is the most demand? Where are the most beds? And also not only for patient transfer, but also human resources transfer from one region to another. Chile is a long country with difficult access. Our geography is very complex. The climate, also the weather is very different from one end to the other, and we learned to work like that. We had more than 14,000 transfer with COVID patients, also not COVID patients, because no matter that we are on a pandemic, we also have demand for patients with other urgencies, cardiac problems, cancer diseases. So we had to keep giving and providing healthcare for them. So we had this more than 14,000 transfer, and we show you where they took place between three regions, mainly Antofagasta, in the center Valparaíso, where is the port, and in the south, in the Araucanía region. We had the most transfer patients from that region to others. Also in Magallanes region, there were an important transfer of professionals, of human resources that were trained to work there. During this time, we integrated not only the hospitals, private and public, but also we asked them to why their hospitality, their bed ability, capacity, show a bigger number of critical beds. That was the bigger demand. We had around 600 beds in each of the sectors, and as we see during the whole period of the pandemic, we had to be consistent in increasing. During May 2021, we had to quadruple the critical beds number to give and to provide healthcare for the patients. The pandemic in Chile has been asynchronic. That means that we have peaks, and in the south, for example, with the outbreaks, and then later in the central region, more outbreaks. So we transfer patients from one region to another to alleviate the region with the outbreak to the other that was with numbers control. So we dispose of critical beds and making big efforts with human resources and healthcare. The collaboration was the most positive thing that we had as a result, because the needs were first. The private sector was very important, not only in critical beds, but also in exams with their labs. Half of the labs that we had and half of the exams that we performed in Chile were done in the private sector. So this joint work has been fundamental. Next one. Another point, to give more freedom to people, that was the biggest desire of the people. We all know that the president said it, the minister said it. These restrictions during the years has been horrible for the population. So we needed a tool to get more freedom. And so from the beginning, the vaccination process that our country had has its one critical pillar of our strategy. Now we have been vaccinating people from 3 years old, also with the 90% of the population vaccinated. This started from the beginning, and the leader of this initiative was the President of the Republic. From the first day, I was there with him from April 1, with 1 month of pandemic only. He sent us 3 ministers, health, science, and foreign affairs, to work together. So when the first vaccines were approved, we could have them. We needed an approved vaccine and to have it at the very earliest stage to vaccinate our population, the Sinovac vaccine. So we started creating the norms, the standards, training people, communicating with all the country to have this process. We have Rodrigo Yáñez, who has been very important for the collaboration between and among embassies to have the vaccines in Chile, the science ministry, who reached out to the scientific world and the labs, and that allowed us to have the vaccines at a very early stage. We didn't know what vaccines were going to be approved, but we knew that we're going to have it in the future. And that was the mission that the president gave us. Always, always science before politics. Secondly, that we had different technologies available. We had activated virus, mRNA, and also vaccines in developing. So when those vaccines were approved, we could have it here in Chile. The scientific world was very important because many of these labs, we had negotiations with them for vaccines for our countries. And the critical pillars of this successful process, and in Latin America and South America, you've seen it. You need to share trust. In our country, we have a trust history in the vaccinations process, in the vaccines. We believe in vaccines. Parents vaccinate their children always in the 90% of vaccination, and more than 80% of the people in risk, in health risk, they get vaccinated also. So that trust wasn't enough. We needed the whole country to keep trusting the politicians, the scientists. People understood that the vaccines, approved vaccines that reached the country, were complying with all the standards of safety and effectiveness. So we gave all the information throughout the process, also the logistics, from a coordinated work from all the stakeholders. The private sector was very important because they stored the vaccines, distributed the vaccines, and the logistics that we already have, we improve it. And lastly, scientists, the scientific society in Chile has a very, very important role. People trust them a lot, and also communication. As Ministry of Health, we work to communicate the importance of the vaccines and that they were safe. Also, important stakeholders were publicly supporting the vaccination process. Next one, a whole country, many people worked on this. Chile has a very complex geography. It's very difficult to go to the north, to the south, get into Puerto Williams, Puerto Montt. It's longer than 36 hours of travel. It's very difficult with the winds, with the cold. The private sector was very involved, the military, the police, the civil society, everyone from their side were supporting this vaccination process, getting the vaccines to distances that could be traveling 48 hours, for example. The private sectors, politicians, also the companies were compelled to give 30 minutes free for their workers to get vaccinated. So all these actions allowed people to trust that what we were doing was positive for them. What are the challenges? I think that we've said it before. The coordination, the common coordination of the region is critical, not only for this pandemic, but for the future pandemics. The viruses has no frontiers, as we already learned. So we have to work coordinated, and we need to start in our region. As we share these experiences and we apply in each of our country and the neighbor country, the health policies, we are going to be able to face the pandemics in a better way. Thank you very much.
Thank you very much, Dr. Daza, for your talk. And now, Dr. Jimena Garzón Villalba, Minister of Public Health in Ecuador, who will talk about Ecuador's response to the COVID-19 pandemic. Good morning, President, ministers. Thank you very much for the invitation, colleagues, ministers, and all who join us today virtually. For us, as a country, Ecuador, it has been a very important experience to cope with this crisis and collaborating with the public and private sector, such as with countries as Chile. Next slide. Thank you very much. Our role as the Ministry of Public Health started in May 2021. We encountered a country that did not have a structured plan, that was experiencing some very severe problems in the public health sector, problems of collaboration and accreditation problems. Vaccination was just available for some groups, and we initiated our work developing a vaccination plan with months before we started working in the ministry. And we also wanted to create a comprehensive control plan, which is called the Phoenix Plan. Because Ecuador is one of the countries that was most affected by the pandemic. We have seen those alarming photos of citizens in several regions of the country, especially in Guayaquil, who were dying in the streets with no medical help, overcrowded hospitals, and no prognosis of improvement. The next slide. When we started working in the health ministry, we developed this comprehensive control plan for the pandemic, which meant coordination, planification, and follow-up on a national level. During the pandemic, using electronic devices like georeferencing, because we could make use of the geography of our country and could still do tracing even at church level, which means that the vaccination rates in a country like Ecuador that has limited economic resources could also access to surveillance and testing and also vaccination. We had 10 pillars, which is epidemiological control, but also comprehensive attention. We monitor our healthcare capacity with primary, secondary, and tertiary care, and we take a look at how to distribute our resources efficiently. Then, after 9 months of working in the ministry, we have seen results, and they were really positive. Such as my colleagues, we are very satisfied, and we're very glad that we saved thousands of lives, because the vaccination process is a leadership of our president, because we vaccinated 9 million people in 93 days, which made an economic impact and also epidemiological impact. Without a lot of epidemiological data, to vaccinate so many people in such a short time allowed us to control the pandemic in a very short time, which means that June, July of last year was not such a bad situation concerning the pandemic in our country. In 93 days, we reached this progress. Such as Chile, we had the great experience of collaborating with other countries of the region. The military, the Red Cross, universities, private sector was involved, and these are the results. As you can see, these epidemiological curves show how the pandemic progressed since our initiation in the ministry. We had, of course, the problem of the Omicron variant. During the first days of December, we experienced a very high increase and a peak, but then cases started decreasing until week 8, as you can see. This is the weekly incidence rate of confirmed cases. And as you can see, the epidemiological curve has been decreasing. These are the confirmed cases that needed healthcare attention, and we can also see a steady decrease. The first 3 weeks were really intense. The second one of 2022 was the highest, and right now you can see that we have come back to the same level, at the same incidence rate as October 2021. This is a curve that we can, and a graph we can compare with the reported and the cases that needed healthcare attention. Reported cases are those that are positive cases because of PCR tests. And then you can see those in the yellow graphs. But then the red pillars are healthcare attention cases, which means that those that needed healthcare attention were much lower, as you can see, as the tendency was decreasing, which was reflected in all the countries of the world. We have talked about different experiences we've had in our Latin American country, and as you can see, that those who get COVID are the young people between 18 and 45 years. On the next slide, you can see the death rate, and of course, this is higher among people of 45 or older. In Ecuador, the first months of this year, we had a little increase of deaths in children younger than 3 years. And then we extended the vaccination program to children of 3 years old, 3 years of age. And from January on, we started vaccinating children of 5 years of age, and then we started with the 3-year-old. And then you can see the tendency of the death rate. As you can see, positivity rate reached 68%, and now we're at 19%, which means it's experiencing a steady decrease, which means that we expect that at the end of March we will reach a 5% positivity rate, all thanks to our great vaccination plan, which has allowed us to maintain control of the pandemic. And in October, we had a 5% positivity rate. What have we seen with this vaccination process? Of course, that it really works. Death rate and mortality rate was decreasing dramatically in April 2021, where we experienced the highest peak of the epidemiological outbreak in our country. We had 43 deaths per 1,000 cases. And then in January 2022, even before we experienced those positive epidemiological rates we see today, mortality rate decreased to 1.6 deaths, which was the highest outbreak of the pandemic in our country. On my next slide, you can see our death rates. On the next slide, I would like to show you how we can compare those two rates. In blue, you see probable deaths, and then in red, confirmed deaths. This is the graph I would like to show you. You can see the amount of confirmed cases that you can see in the blue line. We reached higher levels than in the beginning of the pandemic, but then you can see the black graph that shows the mortality rate, which is at a minimum level, which means that mortality rate is very, very low. On this slide, we see the variants and the genomic sequencing we have conducted, such as other countries in the region. We had alpha, delta, gamma, iota, lambda, and all the others. We sequenced in 3 cities of our countries and the National Public Health Institute. And we received support by the universities. As you can see, just 1% of the sequenced variants is Delta. 99% is Omicron, something that we have seen in the whole region and the world. This week, yesterday, I received the results, and just a 0.7% of the sequenced samples are Delta, and the rest are Omicron variant, which means that Omicron has replaced the Delta variant, and Omicron is now the prevailing variant. Ecuador is one of the countries that has made an impressive effort concerning the vaccination process. And we already fulfilled what the WHO requires. We already vaccinated more than 70% of our population. And this is shown in the indicators I have already showed to you. Right now, 88.37% of the population received the first doses. We're currently vaccinating citizens from 3 years on. We have vaccinated about 40 million people with the first doses. Second doses is more than 80%. And we have also used booster shots, which are more than 4 million doses, which is about 27% of the Ecuadorian population that already received a booster shot. This is our strategic vaccination plan. And we also started, of course, with the most vulnerable groups of our population, 65-year-old patients with chronic diseases, and also those that already had severe COVID, immunocompromised patients, and people who could have severe illness if they were exposed to COVID. How did we achieve it? At first, our president made an effort with support of our chancellor, and they did something we call the vaccine diplomacy. Of course, I would like to thank Chile for their support, because it was a big push for us to reach our goal. We received help from the United States, Mexico, China, Spain, and they helped us to fulfill our goals. When we started our vaccination process, and we started as a ministry, we acquired those vaccines thanks to the help of our government and a lot of other people. We have a very experienced technical staff that knows a lot about vaccination and how to develop mass vaccination campaigns. Staff from the Public Health Ministry that have not stopped at crossing rivers or going up mountains to get the vaccine to the most remote regions of our country. And this was reflected, like in Chile, and this is very emotional for me, that our population has reacted the same way, because we all had the same goal. This has been the biggest social movement we have experienced in our countries. Universities, the Red Cross, other ministries of our government, mayors, the private sector, of course, logistics, vaccination centers were drawn up, and also human resources and trained staff to vaccinate people and register those vaccines as well. And we always reach one conclusion. When we have a common goal and we let go of individual desires, we reach those very, very high goals. This was a very big challenge. A lot of people thought we could not tackle this challenge. They thought that maybe vaccinating 9 million people could be achieved in 5 months, because in the beginning there were just 2 million people vaccinated. But we achieved this goal. Of course, we still need co-responsibility of citizens, social distancing, use of face masks, and we as a Ministry of Public Health have taken up measures to control the pandemic using georeferencing, which means that we have implemented light mobility restrictions for short times, short periods of time. And then the economy started opening up and reactivating. Our ministry was involved in the whole comprehensive control plan and the vaccination process. And of course, this Phoenix plan meant a very efficient epidemiological control. Next slide, please. What could we show with our effort? That we reached the most remote regions. We are leaders in vaccinating indigenous peoples that live very isolated in remote regions. And also thanks to the Human Rights Secretary, we achieved this goal and could reach those tribes and indigenous peoples. And also reaching incarcerated citizens that have already received a booster shot. And as a region, I think we can show that together we're stronger.
Thank you very much, Dr. Garzón Villalba, for your words. To finish with the words today is going to talk the Minister of Health of Uruguay, Dr. Daniel Salinas. He's going to talk about testing and traceability. Good morning. I greet Mr. President Piñera, the Minister of Health, Mr. Paris, also Dr. Paula. We've been collaborating very, very strongly these years. Also, Mr. Ruiz from Colombia, Dr. Caricia Etienne from Pajo. It is our honor to be in this encounter. And what we've seen before we start with the presentation is going to be very precise because we were asked to do it very precisely with regards to the traceability, the lines of action, the cooperation internationally and bilaterally. We want to highlight the first batch of Sinovac vaccines. I want to highlight that fact. That collaboration was permanently exchanging data and other COVID-related data, the points of encounter, the vaccination process, the importance of the vaccine, reaching very high indexes of vaccination in the country, with the 80% in first doses and more than 50% in the third doses, and now we are starting with the fourth doses, and that general politics has impact very positively with regards to the deaths. As Dr. Garzón Villalba said it, this proportion was surplus of the first wave of the P1 variant. That was our very important wave. We didn't have Delta wave, for example. The death rates were very similar. 1 of 6 disease patients in the worst stage, and we share with Chile that we started with the coordination of the beds in a unit in the public sector and also a public monitor of critical beds and we invited both sectors to participate. We believe this was a global phenomenon without precedent in the last century, and this has been a national cause. There weren't political colors. Every of us participated as citizens, and we participated actively from the vaccination, logistics, implementation, accessing the most vulnerable sectors, establishing residences for the elderly. We also did campaigns from town to town, from neighborhood to neighborhood, when we saw problems with the people's mobility, so we got the vaccines to the people. Also, I share with the Colombian minister the answer of the global answer of Uruguay, not only as a health issue, but as a socio-economical and human issue. So we did this comprehensive approach with all our capacities, trying to protect the most vulnerable one and the risk population. And going to the topic, please, next slide. Uruguay, we are going to show you the testing and traceability strategy. We want to mention the importance, the diagnosis, the early diagnosis, the traceability to control the outbreaks, the establishment of long residency homes for the older people, and help understanding the circulation of the virus SARS-CoV-2, comparing with another viruses as the flu. Thus, was very important to strengthen the capacity of the laboratories, and we started with the PCR tests. Please, next, with 30 labs for testing. At the beginning, the WHO mentioned the importance of the diagnosis and testing and traceability test measures. We believe that we are going to face a change stage, but the important thing is that we have to be constantly adapting to the reality, because it is moving as the virus does. So you need to be able to adapt. It's not like in the first stage of the vaccines. It's going to be the same with Gamma or Omicron variants. So there is a very easy of transmission ability, but very hard to conceive. We need to be like this malleable thing for each circumstance. The importance to highlight the trained human resources in the traceability and testing, and how this was adapted to the as the disease advances, and how the criteria changes, the cases and contacts and prioritization is not the same to have 100 cases, 200 cases, the 10,000 cases in the case of Uruguay. So you have to be adaptable. To sustain this strategy, we needed to train human resources. Next, we had to adapt the investigation, the research with regards to human resources in terms of traceability and outbreaks in the health care also. We use technological means. First, human resources. We formed a team with 40 tracers, was the base of the public health, and we went from that to 400 tracers with students, medical students, also retired medical professionals to follow up, to trace the patients. The importance of the traceability is that when the cases increase, we have to implement two very novel technologies. The app that allow us to alarm the distance of 2 meters and 15 minutes. So we send the message to the person, you were in contact with a COVID positive person. So that connection, that direct connection with the app opened a link with a website to show them if they had symptoms and advise them to take a test for COVID. And secondly, when we had a very high transmission rates, we didn't cope with the human team. So we asked the citizens that through the website and the coronavirus app that put every positive patient, put their data in the app so we could contact them and trace them. And it was a mixed tracing with technology, and we went from the COVID test, 50%, very important number, and also the antigenic test, also from the labs to the pharmacies. We have more than 50 pharmacies available to take the tests. So the pharmacy has the system, the epidemiological system, and they input the information in the database, so we don't lose the information. We integrate. These are the screens of the app that show us the interaction and how you are advised to proceed in case that you have a positive or negative test with an alert of exposition, as I said before. If you were exposed to a person with COVID-19, so the person auto-monitor, self-monitor their health and their symptoms to know if they have to take the test or not. And for that time, during that period, keep very alert of their organisms and their work with other people, and if it's possible to work from home. The consultation, the virtual consultation, it was an idea at the beginning of the pandemic, but after 60 or 90 days, we made it real. We implemented the video conference for health or through WhatsApp to monitor and to avoid contagion among the health teams. We have a consultation website with the app, with the daily cases, the new cases, the disease number, and how the cases are evolving and the impact of the vaccination. I believe this is a technological development that was very positive. Here you see the 3 blocks. The first 3 are the regular surveillance, the sentinel surveillance. We are going to go back to that. Was during the before the first stage of the pandemic, the strategies of monitoring. Other colleagues have said it before with arrangements with Brazil and Argentina, the genomic surveillance. We have the tracing team, the tracers that worked with us, and also the freelance and volunteers which generated a community fighting COVID in the country. And we believe this is very important because it wasn't a political thing, but it was a health politics, as it should be. It didn't have to do with parties, with political parties, but with the nation. And regionally, as you said, we need to think of the future pandemics, how we are going to collaborate with each other. Next, here there is the technological tracing, how the person gets a message to their cell phone. We prefer the text message because some phones don't have the WhatsApp technology. So you have to go to the COVID form, you complete the data asked, who ask you to put your contacts in the last 48 hours, and then we send a text message to those people so we can start the self-monitoring. There is a QR code to monitor. And what are the benefits? We have best timing. We linked the cell phone to a result, and the user receives a text message. There is a self-monitor. It gives you data from the contacts. From start to end, there is a very safety process with protected information and confidentiality. And here, Chile gave us a lecture on the recommendations of the proper managed of the information, and we've worked with that with Chile. And we inspired our system based on that. We depressure the core provider. The COVID contact from the ministry website, this forum was designed for the stage of opening of massive events as marriages, ceremonies, parties. Previous to the event, you had to fill out the form. In case we had an outbreak, we could have the information and a fast communication with the attendees of the event. The average of contacts, as you can see, there is a lower proportion of the contacts that you could have, and the main roles in the testing activities of cases and contacts, the creation of the administration of contacts, to have the phones or addresses if they don't have phone numbers, the export of data from our system to others, and the preparation of reports. Here you can see the evolution of the pandemic until the current situation. We see a close to February. We keep going down. At the left, you can see the active cases, and at the right, the R or reproductions that are going down also, how many cases are generated that are positive, and on the right, the positive tests. Yesterday, we were at 21%, for example. Now we have 84% of the population in the country from 0 to 100 years with 2 doses, and more than 50% with 3rd doses, with a high level of compliance. That's it. This is what we have. I want to highlight the approach that together we triumph, not only for Latin America, South America, but also the Caribbean and the areas of cooperation, bilateral, multilaterally speaking. All the America region needs the cooperation, not only from Chile, we received from United States also, and also a donation of vaccines that was very welcome, that was implemented in the population in a very short time.
Thank you very much, Dr. Salinas. We now have some space for questions or other ministries that have joined us virtually to share their experiences in maximum 2 minutes, please. Next one is Dr. Marta Reyes, Minister of Health of Nicaragua. Good morning, everybody. I would like to greet everyone present. We would like to share our country's experience. In Nicaragua, since 2007, we have implemented a development model that has fostered participation of the citizens. And this involves protagonism of families and the community, such as our health programs. This is a model that aims at prevention of illnesses and also protecting people with chronic illnesses. The January 30th of 2020, we published a law to combat COVID-19. We established a protocol together with all our institutions and involving the private sector, which consisted of quick responses to the pandemic that were fostered by all our stakeholders. We had 21 military hospitals involved to take care of COVID-19 patients. Our model safeguarded bed capacities and safeguarded our economic development. In March 2021, the voluntary vaccination process started, and starting with the most vulnerable groups. In 2022, we reached mass vaccination campaigns, vaccinating from 2-year-olds on. Thanks to the government and through the vaccination progress of PEO, we could fight COVID-19. In March 2022, we have vaccinated about 5 million people, which is a vaccination rate of about 85% of the whole population. And about 4 million citizens have received the full vaccination scheme. And parallel to this, we have also maintained our health systems and essential health services for our citizens. To combat COVID-19, we also considered our country's fight against COVID-19. And our family and community health system has supported our approach for this pandemic and also our policies, which also means to safeguard the right to health. It's a challenge, and we have to still tackle this challenge to make a comprehensive approach, to keep working together with the countries of the region. Thank you very much.
Thank you, Doctor, for your intervention. Please consider that you have 2 minutes to share your experiences. We are going to continue with the Dr. Grasilda from Cuba. Welcome, all the attendees. Thank you, Dr. Etienne, for accompanying us. From the start of COVID-19 that inevitably show us the crisis and the different economic status of the population, we have to say that from Cuba, from the first diagnosed cases in March 2020, we started with the prevention and control of the virus, a plan that we've been having until up to this time, working in the territories, and from our Ministry of Health, the work of scientists and the technological industry have allowed us to have products to prevent COVID, antivirals, anti-inflammatories, and others from other countries. As you heard, Cuba preferred their own vaccines. We have 3 vaccines approved in the country, also 2 candidates for approval in clinical trial. So 90% of the people with positive results have recovered from a total of more than 1 million cases. And today we have a death rate of 0.7. All the sectors join together with all the resources to achieve the 0 patient with the disease and 0 circulation in the streets. That is reflected on the data I just mentioned. We've been affected by the policies and the politics of the United States that have prevented us from accessing to deals with other countries. Now we can say 89% of the Cuban population is immunized with a complete scheme, and the 3.6% with 3rd doses. We have 35 million vaccine doses, and the booster for the 54% of the population has the booster doses, and the 76% is on the way of getting vaccinated. We are the first country that could immunize this group in the pediatrics area, and as our principles in hard times, we've been related to 58 countries, and we've been sending help with Cuban professionals of the health sector, collaborating from the beginning of the pandemic. We are on the path of controlling the pandemic. Now with Omicron, the most powerful variant, we are decreasing the cases and the death rates and the severe cases. We want to thank the workers of the health sector, wherever they are, for their efforts to limit the pandemic and saving lives. Thank you very much.
Thank you very much, Doctor, for your speech. I would like to invite Dr. Joy St. John, Executive Director of CARPA. Could you please switch on your camera, Doctor, to see your speech? Then we will continue with Dr. Christopher Tufton, Minister of Health and Wellbeing, Jamaica. We will then continue with Dr. Sylvain Algiri, Head of Epidemic Response Team of the PAO and WHO.
Muy buenos días. Soy Silva Aldigeri. Yo soy el director adjunto.
Good morning. I'm the director of the PAO in Washington, and I have the honor to represent PAO and WHO today. I would like to greet the President, Sebastián Piñera, and all ministers present, and also the virtual delegations and those who join us over Zoom today. I would like to highlight from everything that has been said among the ministers, Colombia, Chile, Ecuador, and Uruguay, some very important aspects. First, how vaccines have saved lives. Such as the health minister of Colombia said, he shared some data, 22,000 lives saved just last year. And then from July 21, the impact of vaccination in South America and then Central America after some months is very obvious. Mortality rate in 60-year-olds has decreased a lot from the moment the required coverage was reached, as I said, first in South America and then in Central America and the Caribbean. Second aspect that I would like to point out, that several ministers have said, which is coordination among the sectors to manage bed capacity. This is very important to save lives as well. And the third point I would like to point out is concerning Dr. Salinas' presentation, which is surveillance. Also, molecular surveillance, which means development of labs and new technologies and tools to manage this pandemic, which means that in this context, I would like to remind and point out what our director said in her introduction, that we are now in 2022 in a situation that on a global and region and sub-regional level and subnational level, we're experiencing a transition period from acute response to sustained control. And the most important points of the honorable ministers, I would like to stress three of them. Of course, there is still a lot of work to do to contain and expand surveillance and genomic surveillance, of course. We have made some achievements, that are really exceptional, and we have a very big regional network that has allowed us to control SARS-CoV-2. And right now, through participation of all countries and academia, I would like to point out 8 laboratories that have helped colleagues and their brothers countries. The second point is there's still a lot of work to do concerning the clinical aspects, which means providing services and our health systems to support patients with new therapeutical methods that we have incorporated recently, new protocols that we keep updating. And finally, I would like to stress this very big vaccination campaign. And of course, the investment in human resources and finance to buy these vaccines for all citizens. But there are some countries on a regional level that we already know that will probably not reach vaccination goals. So we have to focus on those countries and support them. At the same time, we have to orientate groups of the population which we have not been able to reach until now. There are still citizens, adults, that have not received their first doses in many countries of the region. So this is one of the main concerns. And of course, we have to take actions for risk communication to convince people that have had some kind of issues or concerns concerning vaccination. We have to lower mortality rates and protect their loved ones. I hope I could sum up in a short time what I thought are the priorities we are seeing during this exchange. And from my point of view, from the POA, and thank you very much. It has been an honor to join this high-level exchange.
Thank you very much, Doctor, for your intervention. We're going to hear the goodbye words from the Minister of Health of Chile, Dr. Paris. Thank you. To close this activity, I would like to thank profoundly the ministers, vice ministers, and health authorities to share their experiences and points of view, especially our panel. The representative from Ecuador, Colombia, Uruguay, our organizer, Dr. Paula Daza, also the president of Chile, who participated at the beginning of this reunion. There are 12 countries participating in this activity. I would like to send my greetings to Brazil, Suriname, Trinidad and Tobago, CARPA, the Caribbean Public Health Agency, also Nicaragua and Cuba, and would like to highlight Dr. Silvain Aldieri intervention because he summed up the most important aspects of this encounter. There are many phrases and ideas that I had repeated here, and the idea that I like the most was said by Dr. Garzón Villalba, is that together we are invincible. And the Minister of Uruguay said that together we are more powerful.
sin mezclar la política,
the
que no es necesario
working as
en el ámbito
brothers and
sanitario, porque nosotros
sisters,
pensamos
not
que
mixing
el tema de
politics
salud
in
para
health,
todos
because we think
los
that
países de Latinoamérica
the
y el
health
Caribe son temas de
in
Estado. Por lo
Latin
tanto, hay
America and the
que
Caribbean
tener
are
la
state
continuidad.
issues, so
Uno
we
puede
have
hacer
to keep
mejoras,
the
uno puede hacer
continuity.
cambios,
You
pero
could
ojalá
improve,
en
make
temas
changes,
sanitarios
but in health
tuviésemos una
topics,
continuidad.
we
Y como
should have
Latinoamérica y el
continuity.
Caribe también deberíamos
And as
trabajar en esa
Latam and
continuidad.
Caribbean, we
Lo
need to
revisado
work
en esta
on that.
jornada es solo una
What
muestra de todo
we
lo gestado
saw
en sus
in
países.
this
Y cada país yo creo que está muy orgulloso de lo que ha hecho y nosotros estamos muy orgullosos
exchange
de escuchar
it
las experiencias de los
makes us
países
feel
que han
very
participado en
proud.
esta reunión. Todo es valorable,
Everything
todo es
is of
rescatable,
value,
todo es hermoso,
everything is
todo ha significado
beautiful,
sacrificio, trabajo,
everything
sudor
means
y lágrimas, y sobre
sacrifices,
todo
tears,
el
and
trabajo
above all,
de los
the
trabajadores de la
work
salud.
of the
Ellos han hecho y
health
siguen haciendo
teams.
frente a esta pandemia
They
del COVID.
face
Quisiera cerrar esta actividad
and
enviándoles
keep
mis mejores
facing
deseos
the
de
COVID
éxito
pandemic. I
en
would
el
like to
trabajo de
send
salud pública en
my
sus
best
respectivos
wishes
países y
to
no
your health
olvidarnos
teams in your
que
countries.
la unión hace la
And
fuerza,
let's
que
not
somos
forget
hermanos,
that the
así como en
union
otras épocas
makes us powerful.
remotas
Together we are
nosotros
stronger.
luchamos de
We
forma
fight
unida
together
para liberar
to free
Latinoamérica y el Caribe
Latin
y
America
obtener
and the
la libertad.
Caribbean, and
En
to
este caso
have
también
to conquer the
unamos nuestra
freedom.
fuerza, unamos nuestro
And
espíritu,
for
nuestros
that we need
corazones,
to
nuestras almas, olvidémonos de las
get
diferencias
together
políticas,
and
seamos
be one
solidarios y
heart
trabajemos
and be
en conjunto
working in
por la salud de
solidarity
nuestros
for the
compatriotas.
health
Muchas
of our
gracias.
fellow
Muchas gracias, ministro,
citizens.
por sus palabras.
Thank you.
Agradecemos también a los
Thank
equipos que
you,
prepararon el
Minister,
evento,
for
especialmente a la
your
Secretaría de
words. We
Comunicaciones de la
thank
Presidencia,
the
al gabinete de la
teams
Subsecretaría de
working
Salud
on this
Pública, al gabinete de la
organization,
ministra de Relaciones Exteriores,
the
el equipo de traducción,
Minister of
de este
Foreign
evento. Muchas
Affairs,
gracias
also
por
the
su
translators
participación.
for this event. Thank you very much for your attendance.